My name is Austin Hayes. Thank you for scheduling your consultation appointment. This video is meant to be an intro to the procedure you've been thinking about. Hopefully I'll give you some new information, tell you about how I think about these operations. Go ahead and write your questions down. We'll get all of them answered during your consultation appointment. So I'm going to talk about breast lift or breast reduction surgery, and I do a lot of these operations. One of the things to know is that the difference between a breast lift and a breast reduction is really just the removal of tissue. Both a lift and a reduction are a total lift. We want to move your nipple into the center of your breast, remove as much skin as we can in the side to side and the up and down directions. It's just with a reduction, while we're doing that, we remove tissue at the same time to meet your goal size or fix any asymmetry that someone might have. I think the main thing that people need to think about when they do this operation is whether they want an implant placed. The results of a breast lift, again, we move your nipple into the center, remove as much skin as I can, but one of the things it does is it looks very natural. So if somebody comes in and desires a natural look without a lot of fullness at the top, that person's going to do really well with a breast lift. When people come in and desire a round look or they bring in wish photos where the example is clearly augmented, they're going to require an implant. Really, an implant, I should say only an implant, does a great job of giving fullness and roundness at the top of the breast. So we can talk about your goals when I see you in the office. We'll decide whether we need an implant. Many times we'll start with the lift or we'll start with the reduction. We'll perform that operation. We'll give you 6 months, see what you think of it. We can always go back and put in an implant later. It's a really nice way to test out a lift by itself. We don't want to add implants if you don't need them or they're not needed to reach your goals. The other thing it can do is when you separate those operations, it can actually make the results nicer. I can tighten the breast more when there's not an implant in place. So sometimes, even when somebody wants an implant, I'll recommend doing the lift first, again, so I can kind of over tighten their breast. I perform these operations under IV anesthesia. You go all the way to sleep. We have a fully accredited surgery center that we own that's on site at our office. The operation takes a few hours. People go home, you wear a lightly compressive bra, all of your incisions are covered with waterproof Band-Aids, so you can shower at any time. A breast lift is actually kind of a surprising operation in that it doesn't tend to be that painful. So people, although they do take pain medicine, they don't tend to take it for longer than just a few days, and you're really mobile. People might go out to dinner the night of surgery. Certainly they're up and around, walking around their house. I think people think they're going to be a lot more limited than they actually are. People tend to drive after a few days. Returning to work, it really just depends how physical somebody's job is. For people who have a desk job or work from home, working from home, 3 to 5 days. Working at a desk job, really 5 to 7 days, right around a week. Full recovery is 6 weeks, but you tend to be feeling really good at that 1 week mark. We'll talk about how I like to care for scars. I think that although scars tend to be really initially a limiting factor for people who are considering a breast lift, I think it makes them very nervous. What they find is that they tend to heal nicely. The areola incision, so the incision that goes around your areola, blends nicely. It's hidden between your areola and this kind of the natural skin color of your breast. The vertical incision tends to heal really nicely, and the crease incision is the same. It tends to heal nicely and it's hidden in the crease. Again, full recovery, 6 weeks. That's when people return to cardio, swimming, that sort of thing. So I hope that was helpful. Go ahead, again, write your questions down. I'll look forward to seeing you in the office. Thank you.